Hi everyone, welcome to our short little note on classifying COVID-19. We're going to go over all the basics about this virus, looking at a summary of it, what its structure looks like, transmission, treatment, all that kind of stuff. So some of this you might know. I know we did our little exploration of the WHO website back a while ago. But information is changing so quickly with this, so I thought that it would be good to kind of do a little background note on it. And then, if you're watching the news, you might know this stuff as well. But hopefully this just kind of puts us all on the same page, because we are going to be doing a couple activities on COVID-19 over the next week. So I thought this would be a good starting point for us. So first of all, we'll jump right in. We're going to start with what is COVID-19. So if you haven't heard this before, COVID-19 stands for Coronavirus Disease 2019 because it started in December 2019. And coronaviruses are actually a large family of viruses, and some affect humans and some affect animals. So there's a lot of them. COVID-19 particularly is a new coronavirus disease that had not been previously identified in humans. So that's why some people were calling it the novel coronavirus, meaning that it's new. It had not been previously identified in humans. So in the past, there have been two other specific cases of coronaviruses that have spread from animals to humans and then have caused severe illness in humans. And so the first one is called severe acute respiratory syndrome coronavirus, or you might know it as SARS-CoV. And that was around 2002, 2003, I believe. And then the Middle East respiratory syndrome coronavirus, or MERS-CoV, and that was in 2012. And the SARS virus was believed to have kind of transferred to humans by a wild cat. I think it's called a civil or a civet. I'd have to look that one up again. And then the Middle East respiratory syndrome coronavirus actually believed to transfer over from camels. And then now, with the COVID-19, it's believed that that has transferred over likely from bats. That seems to be the most likely possibility. On March 11th, we all remember that day, not so long ago, the World Health Organization declared COVID-19 as a pandemic. So that was the actual day that the criteria was met to be able to call the virus spread a pandemic. So what does the coronavirus actually look like? This is going to be a bit of a callback to our last unit on pathogens and diseases. So coronaviruses are single-stranded RNA viruses. And so what this means is that the genetic material inside, this coily looking thing, we talked about how some viruses have DNA and some contain RNA. And if you're taking biology, you know what those two things are. If you're not sure what that is, that's okay. We will get there in biotechnology. But basically, it's kind of another form of genetic material. So that's all coronaviruses are single-stranded RNA viruses. And like I just said, this genetic material likely originated in bats and then mutated to become infectious to humans. These viruses have a crown-like appearance. So it kind of looks like they're wearing a crown under an electron microscope, and that is due to their glycoprotein spikes. So we know that viruses have spikes, and that's these pink things sticking out here, and it does kind of look like a crown. And interestingly, corona is actually Latin for crown, so they're named because they kind of, their spikes look like that. They have a spherical shape, so if you think back to all their different shapes that viruses can be, they are typically spherical, similar to influenza, and they usually have a diameter of approximately 60 to 140 nanometers, so definitely small. And the envelope here, which if you can see that this is pointing at the red, so the red around that surrounds the RNA here is called the envelope. And that can be disrupted, which would kill the virus, with lipid solvents. So that's such as soap and hand sanitizer. So that's why washing your hands is such a good way to prevent. yourself from getting sick, because it actually is effective in killing the virus. Okay, let's look at transmission. So current epidemiologic information suggests that human-to-human transmission of COVID-19 can occur when an individual is in close contact with a symptomatic case. So this is why, staying in contact with your friends and family online, obviously you're safe doing that. It's as soon as you start to get in close proximity with others who may already have been infected, that's when your risk goes up. So the most common vectors that we're seeing are respiratory droplets, so sneezing and coughing, and actually just breathing. They're finding that droplets are being released and can transfer that way. Close, prolonged personal contact with someone who is symptomatic. So, right there we think about all of our health professionals, our nurses and doctors and paramedics on the front line who are definitely in close, prolonged personal contact with these people. And that's why you hear about so many of those professionals also contracting the virus as well. And then lastly, touching an infected area and then touching your nose, mouth, or eyes. And nose, mouth, and eyes because, as we breathe ourselves, it's easy to breathe in those viral particles, or touching your eyes as well. So obviously wash your hands. We've had that chat. But the kind of scary thing is that it's unknown how long the virus can last and live on surfaces. So it depends on the type of surface. I know cardboard and glass have different rates that they've come up with, but it's still pretty unknown. There's been no definitive answers to this for exactly how long the virus can live on different surfaces. Estimates range from a few hours to a couple days. So super important if you're heading out to the grocery store and picking up stuff that you're wiping things down when you get home. If you're ordering anything online, be careful. Take the packaging off and make sure you wash your hands before you touch your face. All that stuff. And if you have been watching the news lately and happen to see our Prime Minister talk about speaking moistly, he mentioned that masks can help prevent people from speaking moistly on you. So there's a tip from the PM. Okay, so this is probably pretty well known, but the most commonly reported symptoms that we're seeing are coughing, and it's like a dry cough. It's not so much of a I don't know, when you get that sort of fluid feeling in your lungs and you're kind of coughing up stuff. It doesn't seem to really be that. It seems to be more of a dry cough. Headaches, feeling really weak or tired. Fever is a big one, and prolonged fever, like fever that lasts a couple days or is quite severe. Difficulty breathing and pneumonia in both lungs. And obviously these last two are where things become more severe and can lead to possible death if not treated properly or if there's not enough medical equipment available. But there are other things, like they're coming out thinking that pink eye or sort of eye irritation is a possible symptom. There's also some like stomach pain, stuff like that that's coming out that could also be linked. So it's difficult because there are so many different types of symptoms that range from mild to severe. It's hard to know for sure. So just monitor yourself if you start to have any of these symptoms. There's lots of resources online to help you kind of self-diagnose yourself. And then something to note is that symptoms may take up to 14 days after infection to appear. So, and they may not appear at all. There's a huge majority of the people that they think could be infected that aren't showing symptoms at all. So it is a little bit scary that way because, you could be walking around and just haven't had your symptoms appear yet, or could be asymptomatic. So this social distancing and washing your hands is really important, even if you're feeling healthy. Treatment. So there's no specific medicine designed to treat COVID-19 to date. There's no specific antiviral. Obviously, the whole world of scientists is working on this right now, and hopefully in the future they'll be able to come up with a vaccine for this. But as of right now, there's really nothing. But most cases are mild, or at least being able to be treated at home. So the typical self-care methods is really your best shot. So stuff like resting and getting lots of sleep, keeping warm, drinking plenty of liquids. This is all good stuff to prevent, getting infected too. So not just if you think you have it, but before and always. Using a room humidifier or a hot shower to soothe a sore throat and cough, and Tylenol for fever. It has come out that Advil is not good to use. That's been something that's been recommended by the CDC, is not to use Advil, but you can use Tylenol for fever. So if you look at some demographics, so this is just basically looking at Canadian data and who is being affected by this. So far, approximately half of the cases are female, half are male, so it's split pretty evenly. It's not targeting, one or the other. And approximately 1/3 of cases are 60 years old and over. So that actually wasn't as high as I thought it was. I think a lot of the news reports coming out are saying that, it's sort of only affecting the older demographic, but that's actually not true. It's pretty spread out. And this graph here shows that. So this is the age distribution of COVID cases in Canada as of April 7th, so as of yesterday. And you can see that the huge chunk here is actually in the 50 to 59 age range. Obviously, it seems like sort of 40 and up is a lot of the cases, but it is affecting everyone. And that's important to know, that just because you are young and healthy does not mean you're 100% safe. It means that you need to be cautious just like everyone else. But this older demographic, especially people who have underlying health conditions, need to be even more cautious. And then we'll wrap this up. We'll look at some current statistics. We're going to talk about tomorrow or next week, we're going to look at the curve and what exactly flattening the curve means. But as of today, and these numbers are rapidly changing, they could have already changed since I put this together, but as of today, the reported confirmed cases worldwide was over 1 million, and in Canada is just above 18,000, and then confirmed deaths worldwide 79,000, and in Canada just over 400. So, and those numbers are changing pretty quickly. It's important to track it and to try to figure out what that worldwide curve is looking like. So again, we'll talk about that a little bit later. There's 2 links here that I'm going to show you really quickly. The first one is on the World Health Organization's website, and this is kind of neat. It just shows, let's see if I can pull that up. Oh, there's all my yoga videos. So this is kind of neat. It allows you to look at where the biggest impact is. So basically, if you look down here, this is our little legend. The smaller circles represent, or the size of the circle represents how many cases are in that country. So Canada, our circle right there. Oh, so this data is even a little bit behind from what I saw on our government website. But there's Canada. You can see how many cases there are. The US obviously has a huge circle right now. They are struggling. But yeah, you can kind of scroll around and see how different countries are affected. If you want to zoom in on an area, you can. It's neat. This also shows us the curve. So here our new cases, confirmed cases. So anyway, it's just kind of a neat look. Kind of gives you the full picture of everything. And then the second one is similar, but this is on the Canadian government's website. And so let's see if it'll load. So this is being updated. This is being updated in real time. So it's kind of constantly changing, and this is new cases in Canada. So we're going to use some of these graphs over the next couple days to try to analyze them and understand what the actual curve means. But same kind of thing. Oops. I don't know what just happened there. Same kind of thing with this map here with the size circles and showing us where the cases are. So Alberta, BC are being hit pretty hard. Ontario is obviously being hit pretty hard. And Quebec, actually right now in Canada, is being hit the hardest. So something to keep our eye on. And it's kind of an accurate way to come see the full picture of what's going on in Canada. So we can look at cases, we can look at deaths, and we can look at cumulative cases. So we can really, again, we're going to look at these graphs closer and kind of look at the curve. Awesome. So that's everything I have for you guys today. I hope you have a great day and continue to check in and stay healthy. Bye, guys.